Today is Thursday, April 2nd. Welcome to this edition of Nevada County Now. At the time of this recording, there are no new cases of COVID-19 to report. As always, visit mynevadacounty.com/coronavirus for the most up-to-date information. If you're not sure how to go about cleaning and disinfecting your home, the CDC has some recommendations to help keep you and your family safe. Clean and disinfect frequently touched surfaces daily. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them first. Use detergent or soap and water prior to disinfection. To disinfect, most common household disinfectants will work. You can also make your own using bleach. Use 5 tablespoons, or about 1/3 of a cup, per gallon of water, or 4 teaspoons per quart of water. Make sure to properly ventilate your work area, and make sure your product is not past its expiration date. For alcohol solutions, make sure it contains at least 70% alcohol. For a comprehensive breakdown, visit cdc.gov. Interfaith Food Ministry has launched their Senior Food Bag Delivery Service. They have partnered with Gold Country Community Services, the Food Bank of Nevada County, Dignity Health Medical Group, Freed Center for Independent Living, and 211 Connecting Point to make this possible. If you or someone you know could use this service, call 211 to sign up. During this pandemic, some companies are providing discounts to customers you may not be aware of. Auto insurance may be one. If your vehicle is idle during this time, it may be worth a call to your insurer. Your options may be limited depending on why you're taking a hiatus from driving the vehicle or whether you have a car loan. If you still use the car at all, you'll want to keep it insured to stay legal and financially protected. If you're experiencing financial hardship because you lost work due to the coronavirus, insurers and other financial institutions are likely to be lenient. Your credit card company could be another option. Generally, credit card providers offer hardship programs, and some will even provide a small period for non-payment. And those with student loans may find some leniency as well. Federal student loans come with several already existing options. There are 2 ways you can temporarily suspend your payments: deferment and forbearance. With deferment, you may be able to avoid interest accrual, while with forbearance you won't, which means your debt will grow. A best practice during forbearance is to pay down the interest portion so that the debt will not grow. There are many positive suggestions out there for helping kids in these difficult times. Michelle Neeb, a school counselor at Scotton, had this to say. As new feelings of the break from school wear off and the educational efforts increase during this unusual time, you might notice stressed or anxious feelings bubbling up in your children. Here are some common signs of anxiety in children to be aware of. Anger, without your child being able to explain why. Difficulty falling and staying asleep. Defiance as a result of trying to gain control over feelings of helplessness. Suddenly flying off the handle. Lack of focus. Avoidance. Frequent negative thoughts. And over-planning when little to no planning is needed. We can support ourselves and children by finding healthy ways to express stressful and anxious thoughts. Some ideas include talking with friends, drawing, taking a walk, using a calming app such as Calm or Headspace for guided relaxation. A little stress is okay. It even helps improve performance, but recurring stress can lead to health problems. I was also able to speak with Priya Kanal from the Nevada County Behavioral Health Department. Let's hear what she had to say.
My name's Priya Kanal. I'm an analyst with the Nevada County Behavioral Health Department, and I'm also a public information officer, or on the public information officer team for Nevada County.
So what does behavioral health do for the community?
So the Department of Behavioral Health serves both adults and youth with mental health needs for specific populations. So specifically, we're serving those who are on Medi-Cal or who are uninsured and who either have a serious mental illness or for youth have what's called a serious emotional disturbance. So we're kind of serving the highest needs youth and their families, as well as adult individuals who have mental health needs, who are either on Medi-Cal or underinsured or uninsured.
And what is your role at behavioral health?
So I'm an analyst, kind of the jack of all trades of the county positions. Specifically, my main role day to day is I'm the Mental Health Services Act coordinator. It's a funding stream that we get from the state that funds a variety of mental health services, from treatment and recovery all the way upstream to prevention services, which is a really great opportunity for us to tap into, that we don't normally get to tap into since we're so tied to Medi-Cal and billing.
What changes have you had to make due to the current pandemic?
So kind of the big haul has been really setting up those telemedicine opportunities for our clients and for, new clients. We're still accepting new clients. We've largely transitioned to telemedicine and telepsychiatry. So, for example, therapy appointments are being held over the phone, or through FaceTime or Zoom, where applicable. We still have our homeless outreach and medical engagement team, continuing to do outreach and supporting those experiencing homelessness, especially those who are symptomatic and can't safely self-isolate to recover. And then lastly, our behavioral health department in general works with a lot of our contracted providers and our community partners. The majority of our services are contracted out, so our community partners are really, really key partners in our service delivery model. So a lot of the changes we're making, our partners are making as well. The other service to really touch on is crisis services. So crisis services are still available, again, through a combination of telemedicine and phone support. Those experiencing mental health crisis, we have a 24/7 crisis line here in Nevada County. That number is 530-265-5811. That's still up and running. It helps people connect with resources who might be experiencing a mental health crisis. And then we also have a crisis team who's doing assessments, as well as a crisis stabilization unit over by the hospital emergency department room. That's still open at this time. And again, largely through telemedicine to protect the public and staff.
What constitutes a behavioral health crisis?
Yeah, so there's a variety of things. So for example, someone who is maybe having suicidal ideations, thinking about hurting themselves, someone who might be having, psychotic symptoms due to their mental illness. It can kind of range the spectrum, but the important thing to note about crisis services is that they're available to anyone, regardless of your insurance, regardless of your, what hospital you normally go to. Any single person in the county can call the crisis line or go to the crisis stabilization unit. Though, we are taking extra precautions to try to do some pre-screening as much as possible through that crisis line before making referrals to the CSU when possible.
Has there been an increase in the need for your services due to the current issue?
Things are changing by the day, so I'll preface with that because that's really important to say. So far, locally in our community, we haven't seen a huge uptick, but in other communities who are maybe a little bit further ahead of us in terms of cases, we are hearing that from other counties that there's been an increased pressure on their crisis system. So it's something that our county is looking into, how can we prepare for that wave assuming that it does come to us. And I think we have really strong partnerships with our contracted partners who run the crisis stabilization unit and crisis team to start thinking through those precautions.
How is the current situation affecting children in the community?
I think kids like adults, everyone's going to react to it a little bit differently, which is to be expected. And it's just like with adults, it's to be expected that kids might be feeling really anxious and stressed during this time, especially with schools being closed. A lot of kids' routines have been totally turned on their heads. They may not have the same social supports that they may have had previously at school. even down to, food insecurity at its basic level that they may have been having through school. So, again, with stress and anxiety, those can express themselves in different ways in different people. But, some things to look out for would be things like excessive crying, just excessive fear and worriness or sadness, not engaging in things that they used to engage in. Obviously, those things are changing, but, if they're not talking to their family and they used to, in teens, you may see kind of acting out or irritability, maybe even alcohol use or drug abuse. So there could be a variety of symptoms or kind of things to look out for, changes to look out for. Those are some of them. And then, what can parents do? I think one really important thing to think about is that these kids are probably they're probably aware, right, to some degree of what's going on. So it's important to talk with your kids about what's going on, have like an age appropriate but honest conversation with them about COVID-19, symptoms, safety precautions, things that they can do. But on the flip side of that, I'd say it's also important for the whole family to take that in measure with kind of trying to limit how much news we're consuming and trying not to get sucked into this deluge of information and news that can be really hard to break away from. But it's a good practice for both kids and adults to stay informed, but not to let it suck you in completely in terms of constantly checking on the news. Reestablish routine in kids' lives. Kids really thrive with routine. That's a real advantage of school. And it may be even establishing new routines, like developing a daily schedule that you may have had something similar at school, or, if, for example, your family went to church before, maintaining those e-church options. Or if you used to have a broader family dinner every Sunday, could you do that over Zoom, FaceTime? Same thing with friends. If your kids are missing their friends, which I think is super common and understandable, can use a parent set up a FaceTime session with your kids' friends or your kids' parents so that your kids can still talk to each other and talk about what they did that day, or even talk about what's stressing them out or making them anxious.
Do you have anything else you'd like to add?
The other last thing to add is that on our website, both on mynevadacounty.com/coronavirus, on the left-hand side, there's a link for managing your mental health with COVID-19. And then it's also accessible on our behavioral health website on the county website. So it just has some additional tips and tricks, a lot of what we talked about today, but some other resources that other folks have created that could be helpful for families and just anyone seeking information about how to take care of your mental health during this time.
Thanks, Priya. Another thing to do during this time is to reach out to those in our community. Make sure to stay in touch with friends and loved ones or connect with someone who might be living alone. It just takes a phone call or video chat to help make someone or even yourself feel less isolated. We are all in this together. We asked those of you who follow us on Facebook to send us some pictures of your animals. Many of us are spending more time than ever with our pets right now, and they seem to be enjoying it. We've put these pictures together into a little video. We hope it brings you as much joy as it did us. Remember, stay safe, take care of each other. We'll see you tomorrow.